What if a surgeon could print a bone patch right onto your fracture? Researchers just modified a glue gun to do exactly that. Here's how it works. Researchers fused 3D printing smarts with surgery, turning a glue gun into a low-temp printer that extrudes a filament made of polycaprolactone, hydroxyapatite, slow-release antibiotics. It cools to body temp in 40 seconds, so surgeons can fill odd-shaped defects on the fly, printed directly in the OR on the fly. PCL plus HA equals a bone-like scaffold. Antibiotics release slowly for weeks. In rabbit tests, printed grafts beat traditional cement, denser bone growth and better healing over 12 weeks. Fractures were braced with plates and screws during tests. At 12 weeks, the material had degraded by about 10%. Big leap, but more testing is needed before human use. Next up, larger animal studies. Huge potential for trauma surgery. Like this tech? Subscribe for fast updates on 3D printing medicine and tap follow for more deep dives.